Glad you're watching GTU, everybody, on this Tuesday. Laser resurfacing is becoming more and more popular in the cosmetic world.
And Katie from Utah Facial Plastics here to tell us everything we need to know about the skin treatment in the sponsored interview. It is the holidays, so we want to look our best and put our best face forward. Tell us about some of these treatments.
You know, there are a lot of treatments available on the market, and really the biggest thing is trying to decide what your issues are that you're going to address, and then from there coming up with a customized plan with your provider. So when we're talking about lasers, we can kind of categorize them into three main areas. We have light-based therapies, we have lasers that don't burn tissue, so non-ablative, and then we have lasers that will burn tissue or ablative. And so depending on the depth of treatment that you're needing and what we're trying to target, we will choose one of those, or we can do a combination of any of those.
All right, Katie, let's go through a couple of them. One that I've had done twice is called the Halo.
Yes, Halo is amazing. So Halo is a combination. It's the world's first and only hybrid fractionated laser. So what that means is that it's combining two types of laser. It's combining the one that does not burn tissue with the one that does burn tissue. And then when we say fractionated, think of it kind of like aerating lawn. And so we're coming in and creating individual little channels. What this does is it allows us to target whatever our problem areas are, while also allowing us to heal quickly, very limited downtimes. And the great part is that it's good for any skin type.
So Katie, who is this for? You said all skin types, but who would be most benefiting from this treatment?
You know what, when we're talking about laser treatments, there's something for everyone. I think a lot of the times we end up getting caught up thinking that, oh, I have this skin condition, or I have this color of skin, or I have these different histories. That's not at all the case. We can go through and we can come up with a customized plan for every skin type, for every skin condition. And so really there is a laser for everyone on the market.
So Katie, would you say the Halo gets rid of fine lines? It gets rid of discoloration? I mean, we went all the way down on my neck too.
Yes.
With like that looser skin around my neck.
So Halo is actually amazing for all of those things. And the unique thing about the Halo is that I can target whether it's discoloration, fine lines. I can target deeper lines if I want to. We can do some tightening. And I kind of cater that based on what you need. I adjust my settings. And then say you have multiple issues you're dealing with. That's when we start bringing in these other laser modalities and we stack them. And that allows us to use what that laser is best at to target what we're most concerned with.
So one size doesn't fit all. We saw some before and afters and stunning after the treatments. Okay, CO2 and IPL. Let's talk about those treatments.
Let's talk CO2 and IPL really fast. So CO2 and IPL, I think these are kind of like the names that everyone knows when they're thinking lasers. They're actually very old technologies. And so these are not like the newest and the greatest, okay? CO2 is an ablative laser, so it does burn the tissue, but it does it in those hole-like ways in that fractionated technology. We use a different type of laser called the TRL, tunable resurfacing laser. It's not only safer, it was invented by the same man who created the CO2, but he took all of the different problems that can come from that and found ways to help mitigate and reduce it.
It was the downtime after the CO2, because I did that years and years ago. That was the toughest. I mean, I think I was out of work for 10 days.
Yes.
And now that's changed. And the Moxie, you're out even less.
You're out even less time. And so we can find something, whether it's Moxie, whether it's the Halo, or whether we go more aggressive with our traditional profractional or our true TRL, which is the deep, deep laser resurfacing. We can help with all of these things and make it fit your timeline. And then when we're talking IPL, our replacement is BBL, broadband light. The difference is we can target more colors in the pigment spectrum, and we can treat all skin types.
And so can these treatments, and laser treatment in particular, also delay or take the place of potentially surgery?
You know what? They can in some scenarios. I think what it comes down to is what are we trying to target, and are you a good candidate for it? Remember that lasers, for the most part, are targeting skin conditions. So whether it's pigmentary conditions, fine lines, wrinkles, some mild laxity, when you get into the category where we have excessive skin, where we have facial structures that have dropped, that's when it's appropriate to be doing surgery. The best thing is when we combine these. And so people that come in, they have lax, loose skin, they have excess tissue, then we can go through, do those surgical procedures, and then also give them that resurfacing to give them the most beautiful results.
Katie is so knowledgeable about all of this. Yeah. I mean, she knows while we were doing the procedures, she's teaching me about them and what we're doing to my skin. I know you have great deals right now. People want to get this for a Christmas gift.
Yes, it's true. We do. So right now at Utah Facial Plastics, we're doing 10% off any gift card purchases of $150 or more. And then you can save up to $75 on the Illuminize chemical peels. This is an awesome deal. It's a great gift for family members, that person that you don't quite know what to get, but you want to give them something really special and meaningful. So I think that's a great way to go.
Can't go wrong with the chemical peels.
Utah,
that's my
your favorite.
my favorite thing.
UtahFacialPlastics.com for more information. And our thanks to Utah Facial Plastics for this sponsored interview. Katie just had a baby, too. So her skin is glowy because of laser treatments, but also because she's a mom again. Congratulations.
Thank you so much.
It's so good to see you.
Thank you.